without further ado, I will get started. I'm just going to share my screen. Give me 1 second. Okay, there. All right, so, all right, great. So that should be up. Fantastic. All righty. So if I start going and nobody can see my screen, just unmute and shout out. But other than that, I'm just going to get going. So again, I'm Eric. I'm from Rise Life Services, the suicide prevention program. And today we're going to talk about how anybody can save a life. First off, I like opening this presentation with some local crisis resources. These are some resources to contact in the event of a crisis, imminent danger, where a person is a danger to themselves. So we have the 988 Suicide and Crisis Lifeline, 24/7 support. They connect to resources and they have 24/7 crisis counselors. The crisis text line functions very similarly, except we find this to be more appealing for the youth due to it's a little bit less personal. It's a little bit more used to what they are used to. So that's a great resource. We have Dash. They have a mobile crisis team, as well as a hotline for referrals and crisis support, on-site walk-ins in Hotbog. They're available 24/7. They do work with the police and with the hospitals. So if there is an emergency, somebody will come out, provide an evaluation, and decide if hospitalization is the support that's needed, or if there's an alternative method of treatment we're going to pursue. Another one is Stony Brook's CPEP. This is a psychiatric emergency room. Through this is one of the big hospitals, as well as Mather Hospital on the East End. This is more for our Long Island people that live on Long Island. These are some of our local crisis resources. However, that 988 and crisis text line, those are available nationally. So just for you guys all to know, some good resources. So just covering briefly what we're going to talk about, we're going to go over some stats real quick. What are some warning signs? What are some clues a person's thinking about suicide? We're going to talk about what puts somebody at risk for suicide. And also, what are some protective factors? What protect us against suicide and suicidal ideation? We're going to talk about asking somebody about if they're thinking about suicide, how to do it, how not to do it, and how to sort of set up an environment that's conducive to having a positive and productive conversation. We're going to talk about having that initial conversation and persuading a person to stay alive and what that really means and how we can do it. We're going to talk about referring to treatment and resources, and this involves building a team of supports for the person. It's a lot of information, so if you have any questions, just remember to write them in chat or write them down somewhere so we can answer them towards the end. So at the end of this, I really want you guys to feel that you have an increased knowledge on the topic of suicide, increased confidence to intervene during a crisis, and to understand the treatment options and other resources that are available to you. Okay, so let's get started with a little bit about suicide. Basically, right? So the causes of suicide are complex. It's not caused by any one factor. So usually what happens is we see an intersection of what we call risk factors, some current things such as loss of a job. We could have events such as bullying, loss of a friendship, loss of a relationship, an imminent stressor, and then access to lethal means. These are some common factors that we see come into play, but there's a lot more that goes into it than just that. So suicide is often surrounded by stigma, making it less likely that the people that need the help the most are going to seek it and talk to somebody about it. And it's harder for us to know when someone really needs help because of that. So, it's important that we know, about this stigma and be conscious that a person may not be completely comfortable opening up to us right away because of that. The more we understand about prevention, the more we can help the people that we care about who are struggling, the more we can be there and provide positive supports. So let's just go over some myths and facts really quickly. Oops, sorry. So first off is that suicide is inevitable. This is simply not true. Some people, if they are in a crisis and they get the help that they need, they may never actually be suicidal again. Some people, they may experience it multiple times throughout their life. However, we can provide them with the tools and the support that they need to survive these crises, right? So another myth is that asking somebody directly about whether or not they're thinking about suicide will only make them angry and increase their risk of suicide. What we actually see in practice is that when we talk about suicide directly, respectfully, and non judgmentally, it actually lowers anxiety. It opens up channels of communication. And because we're fostering a positive relationship with this person and letting them know we aren't judging them for how they feel, we're lowering their risk of a suicide attempt. Only experts can prevent a suicide. Again, that's not true. Suicide prevention is everybody's business, and we all have a role to play, from clinician to family member to social worker. Anybody in our community has a role to play when it comes to prevention. People that are considering suicide keep their plans to themselves. This simply isn't true. We see often research will show us that at some point in the week or 3 weeks preceding a suicide attempt, people will communicate their intent or how they are feeling to somebody in their circle. We're going to talk a little bit more about what those clues look like in a bit. Another myth is that those who talk about suicide don't do it. This is untrue. It is not about attention. People who are talking about suicide may try, they may even complete an attempt at taking their own life. People who are talking about suicide, that should be right away a warning sign to us that, something is wrong. So it's important that when somebody is talking about it plainly, we are taking that seriously. Another myth is that when somebody decides to complete suicide, there's nothing we can do to stop them. And that, again, is not true. Suicide is actually one of the most preventable kinds of death. We can prepare a person for a crisis, we can prepare people with coping skills and with supports. And in the midst of a crisis, any positive action that we take has a chance, however minute, to save a life. So let's look at where we're at right now. First, we'll start with the country. I don't want you guys to focus on these numbers too hard, but really what I want you to take away is that we're having a steady increase in the suicide rate. Between 2004 and 2021, we saw about a 12% increase in our population. However, we saw a 50% increase in the suicide rate nationally. So what that comes out to is about 48,000 people a year. That in 2021, it was 48,183 people died by suicide. That is about one commercial jet crashing every other day. So it's a bleak number, but that's unfortunately the reality of the situation right now. So it is an equal opportunity mode of death. So it affects people across the lifespan. It affects people of all socioeconomic statuses, races, religions, what have you, right? And again, with this graphic, I just want you all to observe, we do see some ages where the risk is slightly higher. However, we do see that once the person reaches adolescence, the rate of suicide spikes in that 15 to 24 age range and remains relatively stable throughout the lifespan with some increases and decreases. So what's important for us and what I want us to think about, is specifically for the people that we are working with, right? Young people, what are some things that people in this demographic may be dealing with? What are some things that they may be encountering in their life that may cause such a spike and in this age group at that time? So in general, when we're talking about youth and suicide, the rate is increasing with the national rate, about 50%. And we see a lot of young people coming to the hospital for non-suicidal self-injury, so cutting or other forms of harming themselves. We see that almost more than twice as much as adults. So this is something that we are also seeing rising in young people, are incidences of self-harm, which will be a warning sign that we will talk about. So just to give you an idea, suicide in New York State, it was the second leading cause of death for people between the ages of 10 and 34. And actually 6 times as many people died by suicide in 2019 than alcohol-related motor vehicle accidents. Most of our firearm deaths were actually deaths by suicide, not homicides or accidental deaths. So it's unfortunately a large cause of death in our state. In our county, Suffolk County, specifically, for those of you who are not in Suffolk, I apologize. I don't have your specific stats right now. But what we're seeing across our county, and it is pretty representative across the state, is we're seeing a general decline. However, we still have a lot of work to do. We still have lots of strides to make. So Just to give you an idea of in Suffolk County, based on the statistics we have, we can know that at least 4 youth in this county will die by suicide this year with about 100 attempts. So unfortunately, one for every suicide attempt, I'm sorry, for every death by suicide, there's approximately 25 attempts. So that would mean at least 100 youth would attempt suicide in our county this year. So I want to talk a little bit about adoptees and suicide. So there's actually some interesting studies that look at how a person does across adolescence into their young adulthood. These studies track people across their lifespan, and they found a 4 times greater risk for attempting suicide in adoptees compared to non-adoptees. So another study by Goodman and Huang found that adolescent adoptees in the sample that they had chosen were more likely to attempt suicide than non-adopted adolescents. So why is that? Unfortunately, that is not too clear, but we have some ideas. They have found in numerous studies that there are high rates of potentially traumatic experiences that were found among individuals in the samples that were selected that were adopted. So for one reason or another, we know that traumatic stress is a contributing factor in suicide risk, and adoptees have a disproportionate amount of these experiences statistically. So unfortunately, by virtue, this group is inherently slightly more at risk than the general population for somebody of the same age. So all the bleak numbers aside, what can we do to prevent suicide? First, let's know our warning signs. Let's remember to ask the person directly when we see and notice these warning signs. Are you thinking about suicide? We're going to try to persuade the person to stay alive, make a safety plan, and reduce access to lethal means. Next, we're going to connect the person to mental health professionals trained in suicide prevention if possible, and as well as other resources in the community. It is also helpful if we do our own research, attend trainings such as this one to increase our knowledge on suicide so we can break stigmas and open communication, right? We can do things to increase our confidence when we are observing warning signs and we know we need to intervene. Okay, sorry, my PowerPoint froze for a minute. So let's talk briefly about risk factors. Before we get into warning signs, let's talk about what predisposes somebody to being at risk for suicide. So there's 2 types of risk factors. We have historical stressors, distal risk factors, and proximal risk factors. These are our current stressors, our immediate events that are almost acting as a trigger for a crisis. So we'll take a look at some examples. A historical stressor is something that's around for the person for a long time, probably since as long as they can remember. This can be as a history of a mental illness in the individual or the family, suicide attempts in the family or the individual. We actually see a 4 times higher likelihood of a person attempting suicide if a parent has attempted suicide. If we have a history of childhood trauma or sexual abuse, there is a higher risk factor, and any sort of non-suicidal self-injury. We're going to look at some more current stressors in a little bit, but some of the biggest ones we look at are things such as negative interpersonal events. We're talking about bullying, losses of a relationship, arguments with a significant person in their life. Negative affective states, so intense anxiety, depression, agitation, anything that is out of the ordinary for the person and comes on strongly and suddenly without explanation. Sometimes there can be an event that the person perceives as humiliating. In our case, for young people, there may be troubles at school, not being successful academically or socially. These are just some of the many examples of risk factors that a person may encounter. So what we find with suicide risk is we have high suicide risk at the intersection where we have historical stressors, such as a diagnosis of a mental illness or trauma, a current stressor, such as an immediate event like a loss of a relationship or being bullied at school. Then we have access to lethal means. When these 3 things combine, we have a very high risk for suicide. So this is sort of what I like to call an anatomy of a suicidal crisis, right? We have on the left our fundamental risk factors, the things in our history that are contributing to our level of risk. What have we been through in the past? What is the adversity that we are facing on the day to day that it's just by virtue of who we are? Maybe it has to do with where we live, urban or rural. Maybe there's not as much mental health supports with where we live. There's all these historical factors. Then we have that trigger, that final straw, that current event that causes somebody to experience increasing hopelessness and contemplation of suicide as a solution to that trigger, to that problem. So we see what protects us and what protects people from in thinking about suicide as a solution is our wall of resistance. These are our protective factors. These are things that keep us safe and psychologically healthy in the face of adversity. A big one here that I want to highlight is a support of significant others. In this case, it doesn't mean a significant other. It means a person that is significant to this individual. It can be a parent, it can be a friend. For children, we see that at least one relationship with a supportive adult can make all the difference. Sobriety as well, especially with adolescents, substance use and alcohol lower our inhibitions, increasing the likelihood that we make an impulsive choice, right? So these are all protective factors, and we'll go into some more things that we can, like how we can build up these protective factors and put more bricks in the person's wall. Briefly, I just want to talk about the duration of a suicidal crisis. Typically, a suicidal crisis lasts approximately 3 weeks. It can last longer, it can last shorter. But what we want to do is if we notice warning signs, right, where it says initial hazard is countered, right where that crisis begins, and we're starting to see warning signs, we want to make sure that the person has supports in place. We want to make sure that before that happens, we're trying our best to equip the person with coping skills and with a support network that they can lean on and works for them, right? So this way, when we reach that blue part of the crisis, suicidal ideation isn't something that we're contemplating. Even if it is something we are contemplating, we can still help the person survive the crisis by providing support and being there as a positive force in their life for change and having a open line of communication with the person. One thing I want to highlight again, one particularly deadly situation we see is where we have an upset person, there are alcohol and drugs involved, and there's a firearm. This is something we want to avoid as much as possible, especially if we know somebody that we are working with or that we are, caring for is somebody that is at risk. This is something we really want to be mindful of. A majority of people that go on to die by suicide, this lethal triad is involved. So suicide, just as a review, it's preventable. Our goal here is to break that chain. If you remember that diagram, the anatomy of a crisis, we want to break the chain somewhere along the line. Typically, we get to do it after that immediate stressor occurs, that immediate negative life event. That should be our signal to step in, intervene, and make sure the person has support. We want to make sure that we understand that suicide is a result of complicated factors. There's a lot of different things that go into it, but simply put, we can understand it as a mixture of risk factors, current stressors, and access of lethal means coming together. So when risk factors are known, we want to be aware of warning signs. So let's talk about those. Warning signs, these are our clues, right? They're clues, they're behaviors, feelings, talking, anything that indicates that somebody's thinking about suicide. There's a lot of different things that can be considered a warning sign. So we're going to talk about some of the most common, but by no means is it a definitive list. The best course of action is to know the person, right? Know what's normal and ordinary for them and compare what you're seeing now against that status quo. We want to take any and all warning signs seriously, even one, okay? So here's some examples. A person who's thinking about suicide may talk about wanting to die. They may talk about feeling shameful or feeling like they have guilt. They may talk about feeling like a burden to others or not wanting to be around anymore, feeling like they are troubling others with their presence. They may feel or express a sense of feeling trapped or backed into a corner, feeling hopeless or having no purpose. This is a very common thing for people that are experiencing suicidal ideation to express. Sometimes the person might be confused or made angry by these feelings that they are feeling. So we may observe things like unexplained agitation, unexplained rage, or unexplained anxiety that neither we nor the person can fully articulate what the cause is. When we have something like that and we can't identify the cause, we want to make sure that we're asking, the question, that we need to be asking, which is, are you thinking about hurting yourself? So another set of things we need to look at is our changing behavior. Somebody that is thinking about taking their own life may make a plan or research ways to die. What we'll see is that people will withdraw from what they normally engage in. So if somebody's typically social, spends a lot of time with family or friends, that person may withdraw, they may avoid people, they may intentionally spend more time alone, or they might say goodbye. Some people put their affairs in order, so to speak, giving away prized possessions, making sure their arrangements are made for that in the eventuality that they are no longer here, their things are taken care of. We may see an increase in risk taking behavior or using drugs or alcohol. One of the biggest ones that I want to highlight here is loss of interest in preferred activities. If we have a person that is usually very engaged in one activity or one hobby, one subject at school, we want to take note if we ever notice a sudden loss of interest or motivation in that activity. It's common for adolescents to change interests throughout the period of their adolescence. However, we want to make sure that if a young person is dropping an interest, they're also seeking out additional things to fill that space, right? That's what we want to observe. And if that's not happening, that should be a clue to us that something may be wrong. So these warning signs can come in a few ways, and we're going to talk about them right now. So some of the most obvious examples are going to be our direct verbal warning signs. So let's move on to those. A direct verbal warning sign, and these are all verbatim for quotes from people who have gone on to die by suicide. They've said that I've decided to kill myself. I wish I were dead. I'm going to commit suicide. I just want to note that we don't say that anymore. We say die by suicide. We don't want to make it sound like the person is doing something wrong, when we talk about suicide. So, but this is just the word choice the person took. These are additional examples of some things that the person has said. If blank does or does not happen, I will kill myself. This should be cause for alarm for us. A call for the emergency room may be necessary, but these are pretty straightforward. But let's look at something a little bit less straightforward. Indirect warning signs. These are things that somebody may communicate because they're not comfortable expressing how they feel. There's stigma, there's judgment surrounding these feelings or people that are experiencing these feelings. So somebody may try to express how they're feeling in a more indirect way in an attempt to get what they're feeling off their chest, but still make an effort to connect with another person. So these may be things like, I'm tired of life, I just can't go on. My family or friends would be better off without me. Who cares if I'm gone? I just want out. Hinting that they may not be around in the future, or talking about the future as if they will not be around for that future. Or also, one thing we notice in particularly people who have strong religious faith and conviction, they may ask questions related to that in regards to what happens afterwards. So these are some indirect warning signs. So some behavioral warning signs, right? We talked about what we might hear. Let's talk about what we're going to see. We may see a person acquire lethal means. They might acquire pills. They might stockpile, old medications. A person, if there's a gun in the home, they may try to find out where that is and how to acquire it. There's a multiple different ways a person may seek to do this, but that is definitely a very stark warning sign. If we see the person putting their personal affairs in order, giving anything away, having a sudden interest or disinterest in religion, those are red flags for us to know that something is wrong. Again, any sort of substance use, drug or alcohol abuse, especially in adolescence, if we see an increase in that, that's something we really want to pay attention to. So these are just a few things. Again, by no means a definitive list, but some of the most common things we see behaviorally when somebody is thinking about suicide. Again, I just want to review some situational warning signs. These are, again, things that may come up in the person's life that will trigger a crisis. So this could be something like being expelled from school, having to move if that move is unwanted, loss of any relationship like a friendship, death of a friend, a sibling, a family member, especially if it is by suicide, any sort of diagnosis of a serious life affecting or life altering illness, any sort of unexpected loss of their freedom, any sort of financial security. That's not so much something that our young people worry about. However, we do observe that, young people that do not have as much access to certain things for financial reasons are at a higher risk um, than those who do have financial security. We see a loss of a child, of a cherished therapist, a counselor, anything like that, any sort of relationship where the child's relying on somebody regularly um, as a safe person in a safe space. Any loss like that is something we want to keep an eye on. So we've talked about a lot, but essentially, let's say we've identified a person that is at risk. We've identified that they have some things in their past that may place them at a higher risk for thinking about suicide than the average person. Then we observe an event in their life that causes immediate stress, right? One of those current stressors. Then the person starts to exhibit warning signs. Well, now is where that we should start asking ourselves, hey, I think now is a good time to ask the question. Before we get into this, I just want to remind everybody most attempts to talk about suicide with somebody who's at risk are met with relief. This is something that opens a channel for communication for the person. This is something that allows the person to talk about something they never have talked about before with anybody else, right? So, this is a chance for the person to share what they have going on, get some stuff off their shoulders, and it's a chance for us to get to know what they need. So, we can't be afraid to take the lead, right? So, let's go over some tips. If you have any doubt about whether or not you should ask the question if the person is thinking about suicide, don't wait, don't mull it over, just ask the question. Even if the person isn't thinking about suicide, they may be undergoing a different form of crisis. They may be having some other mental health concerns that are not suicidal in nature, but they still need attending to. We'll still open up the door to that conversation. The person's reluctant, we want to be persistent. This doesn't mean that we're going to harass the person. This more so means that if we notice that a person is upset, they're showing warning signs, we want to ask the question, but they tell us, "Oh, you seem busy. I don't want to be a bother," or it's I don't want to bring you down. We want to remember to tell the person, "Look, it's not a bother at all. You can't bring me down. I'm here to talk about whatever you want to talk about. I care about you," right? We want to be persistent in our compassion. We want to make sure we're talking to the person alone in a private setting. This is something very sensitive. We really want to make sure that we have as much privacy as we can, as well as much time as we can. We don't want to cut the person off. So we really want to make sure that we're allotting enough time for ourselves to have a nice in-depth conversation with this person about what they're going through, right? We want to allow the person to talk freely. Okay. And we'll go over, what role active listening plays in talking to somebody thinking about suicide. But this is really important. We want to give them the time to let us know what their experiences are. And again, the more we get to talk to them about what they're going through, the more we know what they need help with. We also want to have our resources handy. We want to do some research passively in our day to day of just some resources that are in our communities that we can refer the person to if we ever need to, right? It's always good to know where to point somebody if they ever need it. So let's go over some approaches. If the person is not going to respond well to a direct approach, so somebody asking them, "Hey, I've noticed you're really upset. Are you thinking about suicide?" We can opt for a less direct approach. We can ask, "Have you been feeling like you don't want to be around anymore? Have you been very unhappy lately?" Do you ever wish you could go to sleep and never wake up? These are different ways that we can sort of breach this sensitive conversation and let the person know we're not judging them and we're ready to talk. We're here for them. But if we can, we want to be direct, meaning we want the person to know what we're asking them. We don't want to beat around the bush. We want to ask them directly. Are you thinking about suicide? You seem to be very upset. Are you thinking about killing yourself? And this is huge. If you cannot ask the question, if you feel that maybe you're not the right person to ask, that the person will respond better to somebody else, let's make sure we're finding somebody that can ask that question, right? And if they need help asking it, let's share some of our knowledge on, what to, how to ask it and how to have this conversation with them so we can best support the person. Now, real quick, we just want to talk about how not to ask the question. We don't want to pass judgment on the person, and we don't want to tell them not to tell us the whole truth. So, things like saying you're not thinking about killing yourself, are you? This primes the person to say, oh, no, I'm not, right? We're already passing judgment in that statement. These following statements, where they label suicide as stupid or a bad idea or selfish, right? These are all things that convey to the person that we're judging how they are feeling, right? We're not listening to this intense pain that they're expressing to us. We're judging their feelings, and we don't want to do that. We want to make sure the person feels safe. So once we've asked the question and they've said to us, yes, I am thinking about suicide, how do we talk to them about staying alive? So, advice, honestly, is not the most effective way to convince somebody to stay alive. Being an active listener and really letting them be able to express themselves and talk about their experiences and their feelings, that is the best way that we can allow somebody to really clue us in on what's going on and what they need. We want to make sure that we're offering hope in any form, right? We want to make sure that when we're talking about the future, we're reminding them that we can get through this, that you are on their side, that you care, and that moving forward, you can help them in your capacity. So we want to remember when we're talking to somebody that suicide and suicidal ideation itself is not the problem. It's only the person's solution to a perceived insoluble problem. So when we're talking to somebody about what they're going through, let's try to keep in mind what is the problem that this person is encountering that they feel they cannot escape, right? And once we kind of have an idea of what that problem may be, let's explore that. Okay, let's maybe have a conversation about that and see what the person is really going through. When we offer hope, again, just want to touch on this. We want to let them know that we care about them and how they feel. We want to let them know that you're there for them and that you are here for them through this struggle. We want to remind them that we want them to live, that we're on their side. But we also want to keep in mind that we want to remind them they're not alone in that we have family, friends, people in our community that also care about them. And maybe we should ask them if there's anybody else that they might want to talk to, that they might want help from. And we always want to make sure we're affirming their feelings. These things are very real. These feelings are very real to the person. So we want to make sure that we're acknowledging that the person is experiencing something extremely difficult and they are being incredibly strong to talk to you about it and to seek help and to carry on. So we want to commend them for being strong and affirm that this has been hard for them, but we can get through it. So remember, we're going to listen actively. We're going to encourage the person to elaborate on things. If we want some more clarity, let's not be afraid to ask for it. We really want to make sure that we're allowing that person to explore their feelings with us, so we get a good idea of how we can help them. Then we want to ask them towards the end of this conversation. We want to ask them, "Will you go with me to get help?" Right? This is the best thing we can do is take the person directly to help, a counselor, community support, the hospital if needed. If they don't want to go with you, we can ask, will you let me get you help? Will you let me help you? We find that this is commonly a good question to ask adolescents. They want a sense of agency. That's something that everybody wants, a sense of control over their own choices. So we want to ask the person, how can I help you? What do you need from me? Right? How can I help you get what you need? Is there anyone else that you want me to help you tell about how you feel right now? Is there anybody else we want to bring into this circle, right, to help support you? And what can we do to keep you safe? Again, we should make sure we're talking about what they need in the moment and how we can help them. So we're going to review really quickly. So we're going to take all these warning signs seriously, right? We're hearing the verbal warning signs. We're seeing our behavioral and our situational warning signs. So we're going to ask the person the question. We've planned plenty of time. We've found a private place and we've asked the person, hey, I've noticed you're feeling really down lately. Are you thinking about killing yourself? They say yes. So we listen actively to what they have to say and we gauge what type of help they need. All the while, we're offering hope and letting them know we care. Once we've done that, we're going to plan our next steps. Our initial interaction with the person has concluded, right? We've already started that conversation about getting help. If emergency intervention is necessary, that emergency intervention is accessed. But what comes after, right? How do we support the person going forward? We're going to make their environment as safe as we can. So this is huge. It's something called means restriction. A lot of evidence backs this up. So, removing access to means of attempting suicide in the person's environment is associated with less deaths by suicide, specifically by firearm. If the person has access to a firearm, it is imperative that that firearm and the ammunition is locked in a safe, if possible, we really should try to get the firearm out of the home with somebody we trust, a relative. I know the gun laws in New York are complicated, so that's not always possible, right? But we want to try to make access to that firearm as difficult as possible. We see studies with youth, they're exponentially more likely to die by suicide if they're using a firearm than by youth who use other means. So we want to make sure that we are restricting that access. Another big one is medications. Any medications we're taking currently really should be stored somewhere locked if we know that we're living with somebody who's at risk. Any medications we no longer need that could be potentially lethal should be disposed of properly and as quick as we possibly can, right? We want to make sure it's as hard for this person to harm themselves as possible. This next bit is very hard. We can't realistically remove all knives from the home, and we don't want to start throwing locks on all the doors and stuff because that is stigmatizing. So, some ideas with what we've come up with some parents is if sharp objects are a concern, we can always have a lockbox for them and then place them in a drawer that isn't locked so we're not staring at a lock on a drawer, right? If there's a rope hanging up in the garage for yard work or anything like that, we want to make sure we're just putting it somewhere that the person doesn't know where it is, where they can't access it, right? So if there's anything readily available that we use every day that can also be used as a means to take one's own life, we just want to make sure that we're being careful about how we store these items and being conscious about the potential risk of any potentially lethal objects that we do have in the home. And again, we see time and time and time again that many people do not seek other methods of taking their own life than their initial planned method. But when they do, if their means are restricted, the means that they choose are less lethal and they're associated with fewer deaths. So making an environment safe, restricting means is huge. Another big thing we see with a particularly at-risk group, LGBTQ plus people, we want to make sure that we're creating affirming spaces where that, if it's either our practices, our organizations, our homes, we want to make sure that we're allowing people to use the pronouns, the things that they identify as, because these things are associated actually with a lower risk of attempting suicide in these populations. So affirming spaces that people from this community feel are safe for them are more conducive to healthy coping skills, positive adaptations to crisis and to adverse events in life. So, we just want to make sure we do what we can to make sure that our spaces are safe spaces. Some other things we want to bolster, right? So let's focus on some other things, right? What can we help the person add to their lives? Let's work on some coping skills. Let's get them to see a counselor, right? Or somebody that can help them with problem solving skills. We want to see an engagement or a connection in at least two of the following areas: school, friends or peers, with sports, any form of employment, religion, any form of community. It could be a hobby that has a community. We want to see engagement in at least two of these. In our program, we look into the community to engage kids with activities that are aligned with their interests so that they are being introduced into these communities to build a sense of belonging and a sense of purpose. This is huge. We want to make sure the person has at least one supportive and reliable, stable relationship with a family member or a trusted adult. This could be a teacher, it could be an uncle, it could be a parent, it could be anybody. But having that relationship is so important. It makes a world of difference, especially with young people. We want to make sure there's plenty of opportunities for our young people to explore their interests or explore different communities within school and our communities, right? So we want to make sure that we have the presence of people in our lives that are there to help us develop our skills, develop our interests, right? Because these are the things that give us, again, a sense of purpose. They give us a sense of worth. A thing like physical and psychological safety is also very important. So, both in our communities, in our homes, in our schools, we need physical and psychological safety. One of the most common things we see, especially with young people, is psychological safety being breached, specifically by bullying in school. A child's home may be safe, a child's community may be safe, but if they're being bullied in school, that's a large chunk of their day and their lives where they don't feel psychologically safe. And that can actually really have an adverse effect on a child. So academic achievement, intellectual development, of course, we want to promote this. This again is tied back into, our feeling of skill development, chasing down things that interest us, and promoting high self-esteem. Right? These are all areas we want to focus on. So how do we get help? I know that I'm sure we all know finding a therapist right now is so difficult, but there are ways to do it. It's not impossible. So of course we want to take the person to that clinician directly if we can. We can help them set it up if they don't want us taking them, or we can at least give them the information if they really don't want our help and try to have a conversation at a later date. Again, though, if the situation is imminently dangerous, we want to make sure we're calling 911. Any situation in which you believe the person has a plan and intent and means to harm themselves, any one of those things, we should be contacting emergency crisis resources if we know they're at risk. So we're going to make sure we're connecting with our counselor, but let's also remember other members of our community that we can lean on. We have religious leaders, people that work at different community organizations. We have sports leagues that have coaches that act as leaders. There's different people in our communities, such as school mental health staff, that all can help us when it comes to supporting the person that is at risk. We want to make sure that we're living by that phrase, it takes a village, right? We're really involving as much people as we can that the person is comfortable with, right? We want to build that team. This is huge. We want to build a team. The more hands that we have, if we're working with our therapist, we're working with the school, we are working with anybody that is, involved in this person's life that may be a form of support. We're all able to connect and powwow and see what we can do better to support this person. So oftentimes it's hard to find a therapist. I always tell people, you can look for a provider by contacting your insurance using the online portal. That is a pretty straightforward way to do it. But what I also encourage people to do, and parents, is let's do some research on local nonprofits, local organizations and community orgs that provide mental health counseling. There's a lot of great programs out there that do have providers. Some do have wait lists. Right now, that's pretty common, but we want to stay diligent. Unfortunately, accessibility for mental health care right now is not as open as we would like. But if we stay persistent and we stay diligent, we will be able to find the person a provider. This is called the Suffolk County Directory of Behavioral Health Services. Most counties across the state, I'm pretty sure every county across the state has something like this. It is a directory of behavioral health services. So this is good to use to look up in your local area what may be available to you, what may be, there that you didn't know about. So again, we're getting others involved, we're being part of a team, and we're reminding ourselves that we're going to check in with this person. A simple check-in goes such a long way. Just checking in once a week. It could be a phone call, it could be a card, it could be a text message. You know, just simply letting a person know that you care may save their life. And let's remember to continue to be non-judgmental, right? Going forward, even with the person, we remember to be compassionate and empathetic to their struggles and to really listen to what they're telling us, and affirming them, and making sure that we are continuing to listen actively. So this form right here is something called a CSSRS. It's the Columbia Suicide Severity Rating Scale. We use this at our program on intake every 3 months, and when we observe a current stressor in our participants. It's a series of questions that we ask that give you a idea of where the person sits with their risk level. If a person says yes to anything that is highlighted in red here, we would be contacting emergency services. If it's in the yellow or the orange, we're going to be setting them up with something called a safety plan, which we'll talk about in a moment, and making sure they're connected with weekly therapy, so on. The reason I show you guys this is because, I just want to make sure, in your work and as you go on, let's, ask your providers, ask the mental health providers that, our kids are seeing. Let's ask, people we work with, do you guys use the CSSRS if there's a warning sign for suicide? It's always a good question to ask. It's a really simple tool, and it's good to get everybody on board with using it. It's pretty standard. And this is something called the Stanley Brown Safety Plan. This is another widely used tool, especially in the clinical world. This is great. This is a form that a clinician would fill out with a patient, and it goes over warning signs that the person themselves can recognize. Oh, when I am going into a bad place, I do X, Y, and Z. I feel X, Y, and Z, right? So they know. They list internal coping strategies. We list people and places we can go that provide distractions. We provide people that they can call during a crisis, the agencies that we can call during a crisis, our emergency crisis resources, and steps to make our environment safe. What this is, it's a step-by-step for somebody when they notice a crisis coming on, right? There's even an app for this where a person can download this to their phone, so they always have it on them. So if they know that they're heading into a bad space mentally, we can check our safety plan and start at the top of the list. Are we experiencing these warning signs? Let's start using some of these coping strategies. If that doesn't work, let's go to these places or these people. It's a wonderful tool. I highly encourage anybody to use this with somebody who's at risk. The clinician or the person working with the child gets a copy. The parent gets a copy if they want, and the child would get a copy too. You don't need to be a therapist to help somebody plan for their own safety. And here's the big question big thing I want to emphasize. If the situation is life-threatening or dangerous, if we have any sort of reservation that this person is a real danger to themselves in this moment, or possibly a danger to somebody else, we want to make sure that we're calling 911. If it's safe to intervene, meaning there is no imminent risk of danger or harm to yourself or another person, we're going to attempt to intervene. But no matter what we do, we're going to attempt to de-escalate the situation, right? We're going to try to calm verbally. We're going to try our best to talk to the person about what's going on and remind them that we can get through it and that help is on the way. And then, if possible, when we see the onset of a crisis and there is an immediately dangerous situation, we want to remove all lethal means from the environment as soon as possible, if possible. Okay? So if somebody expresses to you that they want to take their own life and this choice is imminent, we want to make sure that all lethal means in the person's environment are removed or restricted. And I know this is a serious topic, everybody, but I really want you all to remember if there's anything I want you to take away from this, it's this. It's that most people who are thinking about suicide will not get angry if you ask them. If you're somebody that is coming to them non-judgmentally and coming to them honestly wanting to have a conversation with concern and care, it's going to be met with relief. Most of the time, the person is going to feel relieved that they're able to have this conversation. So let's not be afraid to take the lead. Let's be brave because the person's life could be at stake. Again, I just want to reiterate, it's really important for us all to know our local resources. That's our 988, our crisis text line. We also want to know what's available in our communities. For Long Island, we have Dash and Stony Brook CPEP. Across the state, I know there's lots of different resources, but it's always good to do your research, and find the different resources that are available in your area. You'd be surprised what's out there.